Hi, it's Dr. Ify. In my video on breast clips, I mentioned that we target the clip and then the surgeon removes that area. These are the calcifications we need to biopsy. We take the specimen, x-ray them, you can see them there. Because we've taken most of the calcifications, we put a ribbon clip for targeting. So how do we target it? We do it with something called a localization wire. Remember that for some of these lesions, the surgeon cannot see them. They're only visible either under ultrasound or mammographically. So what we do is we put these clips and then we put a wire and we leave a wire in there for the surgeon to use as a guide to take out that area. I'll show you what this looks like. They come in different sizes. These are Copen's wires. The wire itself comes inside, is inside the needle, and I'll put it against my shirt so you can hopefully see. The end usually has a hook so that when I put it in the lesion, it just stays hooked in there. And so in the breast, the wire is usually inside, and what's left is a bit of wire sticking out. And we usually tape the wire down on the breast, and the patient then goes to surgery, and the surgeon uses it as a guide to take out the area of interest. So we can place these under ultrasound. We can also place them using stereotactic guidance, so mammographically. I'm gonna just try and use an orange and show you what this looks like. Let's pretend that this is a breast. I'm using ultrasound. There's a lesion in there that's got a post-biopsy clip, or maybe it's just a lesion without a clip. It's too small for the surgeon to see. So what happens is I usually put a little bit of freezing. I put the lesion in. I like to put the tip of that needle just a little past the lesion that I'm targeting. And then the trick here is to then remove the needle, but to leave the wire in place. I take the needle out, but the wire stays in. There we go. So that's it. So what's left, this is the breast. The wire is in the breast with the tip just past the lesion, and I'll show you an example. And so what happens after is then we just sort of tape it down on the patient's skin. There'll be steri strips here. The patient goes for a mammogram. We take images and we show the surgeon where we've put it. So we want it fixed pretty firmly for surgery. After the surgeon removes it, the sample is then x-rayed to make sure that we've got the whole wire in the sample that was taken out. This is the sample. This is the tip of the wire. Maybe the calcifications are here. Everything comes out. This whole sample is x-rayed, and it looks something like this. And so that's it about wire localizations. As usual, if you have any questions, please put it in the comments. Like, subscribe, follow, share. Thanks for watching.